If you want to build back your muscles, get stronger bones, and sleep well at night, if you're over 40, growth hormone is low, this is the best way to raise it up. That is my topic today.
Hi everybody, it's Dr. Bar. Today I'm going to talk about MK677, the controversial molecule that actually stimulates the growth hormone. I'm going to represent peer clinical studies, meaning studies that have been properly peer reviewed. There are 4 pillars of clinical evidence that it really enhances the growth hormone and gives us 4 clear benefits. Number 1, increase fat-free lean body mass, increases your body mass in muscles. Number 2, improves the bone density, and that is also research that proves the bone turnover and the mineral density improved, especially in older patients. Number 3, sleep quality, increased REM. Double-blinded clinical studies show that it increased REM. And 4th important pillar, recovery and vitality. This is very important, increasing the growth hormone and its markers, and that is very important for anti-aging. So finding number 1, increase lean body mass. That's amazing. The clinical studies showed that the bulk of the muscle increased and the breakdown, the catabolic effect that happens with aging was decreased. This also reversed the diet-induced muscle loss, so spiking the growth hormone and its marker IGF-1 for better body composition. You see in this curve, primary randomized trials for healthy older adults. So the outcome, fat-free mass of muscles increased within 12 months of the study. Reported effect, users often felt fuller muscle and pumped. Now the next thing is important to report, because the increased muscle mass or lean mass that was reported also showed some gains that happened because of the water retention, like creatine. You guys go to the gym and you know that. So this is important. When you check your scale, you know that there will be some increase in weight, but it's not going to be all muscle. Some of it will be water, and water is heavier than muscle. So the second finding is very important because everybody loses bone density, and of course it's very important for longevity and health, because as people age they break the bones, and that is the biggest risk for unfortunate hospitalization and complications. So the study showed bone mineralization increase, which is very promising, especially in older adults. This was found that the osteoclastin, that's the protein that improves the bone formation, was increased in especially elderly patients. That is a significant finding. Number 3, enhanced sleep. That is amazing because double-blind trials have showed qualified significant improvement in restorative sleep. Who wouldn't want to have that? We want to sleep well. So deeper sleep, more restorative. In the clinical studies, you can see the placebo and the MK677 bar going up further. And that is important because deep sleep is very important. We heal, recover, regenerate, and if you sleep well, you have a great life. Now, finding number 4, accelerated recovery and anti-aging effects. This is very important. They measured that through the growth hormone levels. So this was a very significant one for patients because it is significant for vitality. In older adults, MK677 restored growth hormone and IGF-1. Growth hormone, by the way, declines starting like late 20s and 30. So it is important because the levels were seen of a 20-year-old. That's amazing in older people, which is super amazing because this was supporting their overall energy level, improved their skin health, and reduced their frailty. That is super cool. So this is a favorite molecule that I like, the MK677. Some people call it a peptide, but it's not. However, it's a synthetic that stimulates your growth hormone. And in summary, it increases your lean body mass, reverses the muscle loss. It improves your sleep quality, including the REM, the one that you go to sleep and dream. Improves your bone density, boosting the bone turnover and the build up of bone instead of breakdown. And 4th, recovery and vitality, restoring youthful growth hormone levels. Isn't that amazing? Conclusion, it's a really great case studies that I have collected, all these about the MK677 producing significant physiologic benefits in addressing the age-related decline, especially for older people. They see a decline in growth hormone, which is the building hormone. While the existing evidence is really compelling, I think it underscores the need for further clinical studies to make sure it is safe and its efficacy is valid. So this is only a presentation, it's not a medical advice, and I think it's a great molecule that we can use for short periods. Since most of the studies have been short, I use it for my patient for a short period, and that helps them build the muscle, gives them that extra growth hormone boost. And thank you so very much for that. If you have tried MK677, please put a note down there or in the comments and let me know what your experience is. Or if you ever checked your growth hormone levels. Are you 30? You better check your growth hormone. Thank you for tuning in. I appreciate your time.